Well, as drug companies and scientists sprint forward in the race toward a COVID-19 vaccine, many of you are asking if you're going to take it. But what happens if you're forced to get that vaccine by the government? Or what about your employer? Is that something they can even do? Well, this morning we're taking an in-depth look at what's possible when it comes to mandatory vaccination with a public health law attorney and professor, a doctor working on that vaccine, a pro-health choice activist, a pro-vaccine former state senator, and a current state senator.
It's really an experiment that you're witnessing, that the world is witnessing in real time.
Dr. William Hildebrand is leading a team of researchers at the University of Oklahoma, one of more than 150 groups vigorously working on a COVID-19 vaccine.
We've never taken all the tools that we've accumulated in science and deployed them in unison on a problem like this.
Hildebrand successfully developed vaccines for West Nile virus and melanoma. Started working on the virus called SARS-CoV-2, what we know as COVID-19, back in March, infecting human cells with the virus and seeing how they react.
We decided to study this virus in particular, rather than learn from past coronaviruses and plug that into a vaccine.
But with the CDC telling states earlier this month to prepare for mass distribution of a possible vaccine by November 1st, many Oklahomans are wondering if that vaccine could be forced on them. Is that even possible? The short answer, yes.
A good example of that is some state laws will require nursing homes to ensure that their employees and even their patients' residents to be vaccinated for influenza every year.
Ayla Haas is an assistant professor of law at the University of Tulsa and a former public health attorney for the CDC. She says there is a precedent set for state and local governments mandating vaccines, notably a Supreme Court case from 1905. Jacobson versus Massachusetts.
That was an instance where state government was allowing local governments to require mandatory vaccinations, and that was upheld by the Supreme Court as constitutional because it is both the responsibility and the duty of a government like states to protect and promote the public health and welfare of their citizens.
Something New Yorkers in several Brooklyn neighborhoods saw just last year when a measles vaccine was mandated for residents after an outbreak. But the most prevalent example of vaccination laws occur in schools, students having to submit a shot record showing that they received their required vaccinations, or they can turn in an exemption form.
Essentially, vaccines are not mandatory because
Liza Greavy is executive director of Oklahomans for Health and Parental Rights.
Anything that is put on your body, in your body, even food and supplements that are generally safe, that needs to be a personal choice because everybody is different.
That's why there's a medical exemption for vaccines across the board. Oklahoma is one of many states that allows for religious exemptions, and one of the handful of states that goes a step further, allowing a personal belief exemption.
And that's all fascinating because, what's a personal exemption?
Dr. Irvin Yen is a former state senator who tried to pass a bill getting rid of the religious and personal belief exemption.
I literally worked 4 years to try and tighten up our vaccination rate in Oklahoma without any success, nowhere near success.
So are bills like that essentially just dead on arrival here in Oklahoma?
Yes.
So in the upcoming session, if a state legislator were to propose a possible COVID-19 vaccine mandate in any form, you feel like that would just not fly?
Yes, I do, unfortunately.
One current state senator working to make sure that a COVID-19 vaccine mandate doesn't happen, Senator Nathan Dahm of Broken Arrow, who sent Two Works for You a statement saying in part, "I plan to introduce legislation next session that prohibits every level of Oklahoma government from instituting any sort of forced vaccination requirements. The SCOTUS Jacobson opinion should be thrown in the trash bin of history. Government's job is to protect our rights, not purposefully exert force on law-abiding citizens who aren't purposefully harming others."
We are already in talks and in dialogue with legislators coming back into this session about bills that would protect consumers, that would protect employees if their businesses were to say, hey, you can't work if you don't get this.
So while a mandatory COVID-19 vaccine looks very unlikely from the state legislature, there are other ways that you might be required to take the vaccine.
It is possible, for example, that facilities might require vaccination to participate in some sort of mass event that might have a lot of crowds.
But Haas says even more roadblocks lie in the way of a mandatory vaccination. especially a potential vaccination that would be approved under emergency authorization use.
This idea of vaccine approval, the processes that were established, takes a really long time, years and years and years. It's definitely a possibility that we are taking some shortcuts in terms of getting this vaccine on the market. So I could see a court also saying that there are concerns with the vaccine mandate if we don't actually know that the vaccine is safe.
In your research in looking at this kind of stuff, from whenever all of this started at the beginning of the year until now, is that an adequate amount of time to study a virus, develop a vaccine, get it into trials, and get it out to the public?
It's absolutely unprecedented. No one's ever had Operation Warp Speed before. No one has stepped up and pumped billions and billions of dollars into it. No one has in parallel designed and tested the vaccines and in parallel manufactured a vaccine that might never be used.
And Dr. Hildebrand there says that the first vaccine is likely not going to be the only vaccine because it might just help a certain population. And as far as legislation goes, either for or against mandatory vaccination, we're not going to know if state lawmakers plan to officially file bills like that until November.